Here in Canada, we've got public health officials from various different provinces saying it's time to learn to live with COVID. British Columbia, Alberta, even the Chief Medical Officer of Health for Ontario, which is one of the more lockdown restrictive provinces, or at least has been for the past year and a half, even their new Chief Medical Officer, Dr. Kieran Moore, saying, we gotta learn to live with COVID. This isn't going away. It's an endemic illness. And part of that advice from these medical officers has been, we've got to stop obsessing over the raw case counts, because as vaccination rates increase, as natural immunity from prior infection increases, what it means to test positive for COVID-19 means something very different. It means less substantively than it did in the past in terms of what that denotes for serious outcomes and hospitalizations, ICU beds and deaths and so on and so forth. Which is why we see a different discussion and even a different way of reporting the numbers from different officials in all of these provinces. For example, I'll give you one little example. Christine Elliott, she's the Health Minister of Ontario, and every day at a certain time she tweets out, well, she used to tweet out the new daily cases for Ontario. Now she does it a little differently. She isn't so focused on cases. That's not the first thing her little Twitter thread of latest developments in Ontario about COVID is about. Talking more about vaccination rates and then statistics around hospitalizations, and then gets to the case count, but is acknowledging that, okay, the case counts just aren't that big of a deal. But I noticed that there are a lot of people across Canada who just still can't internalize that message from our public health officials, that cases, they just ain't what they used to be. They don't matter as much as they used to matter. So when you hear people say, oh, we've got these projections about COVID cases, let's talk about modeling with cases and so forth. Okay, do what you want with your modeling, but why? Why should we pay such great attention? Why should it matter so much? Please don't tell me, oh, we gotta shut this down, we gotta shut that down because of rising cases. No. It doesn't work that way anymore. And it's kind of frustrating to see that there are so many people, including some people in the medical community, who are just so resistant to evolving the way we look at COVID-19. They are resistant to acknowledging that this is evolving into being an endemic illness, one that can be quite serious for a number of people, so needs to be taken seriously in certain respects, absolutely. But this basic argument, and I always had problems with this basic argument whenever it would occur, but the one from previous incarnations where you said cases are up, society must lock down. I had a lot of problems with the way we had that conversation in the past, but now, like moving forward, that it's not even a serious conversation. Whatever you thought about things in the past, that moving forward, well, that's not what the medical officers of health are saying. That's just junk science. And yet there are some people who are so seized upon it. They just still don't want to evolve into a new response to dealing with those numbers. And it's really integral, I think, moving into the fall, that all of those officials, BC, Alberta, Ontario, elsewhere, who are saying it's about learning to live with COVID. It's about learning that the raw case numbers, let's please stop obsessing over that. Well, that's what they're saying, and that's the program everybody's got to get with now, moving forward.